Hi, thank you for joining me today. My name is Doreen Donovan. I'm a clinical wellness nurse with the Wellness at Work program through Berkshire Health Systems. Today I'm going to be talking with you about the correct techniques for home blood pressure monitoring. What I'll share with you today are how to get the optimal blood pressure with how you're sitting, the techniques you need to use to get the best reading possible. So to start with, you want to make sure that you have the correct equipment. I know that some people do use the wrist monitors to help monitor their blood pressure. They're not as accurate as the cuffs that go on your upper arm, so I would recommend that you do get a cuff that does go on your upper arm. We like to use the Omron product as they have a good blood pressure cuff that's very reliable. So when you are checking your blood pressure at home, it's important to make sure that you do it with an empty bladder, as a full bladder can raise your blood pressure. You want to make sure that you wait at least 30 minutes after exercising, after eating, or having a cigarette, as all these can temporarily raise your blood pressure cuff. The other things you want to make sure is that where you're sitting is going to give you the best possible reading. You want to make sure that you're sitting in a chair with your back supported, your feet flat on the floor, and your arm that the cuff is going to be on supported on a table. And you want to make sure that the cuff is going to be at heart level. So those are things that are going to give you the best results. If you're crossing your legs, that can give you a higher reading. If you're holding your arm out and tightening it, that can give you a higher reading also. So this is what is going to give you the best result. So when you're putting on your blood pressure cuff, this one here has a little dot, and this is going to go above my brachial pulse. So it's important to know how to check your brachial pulse. So your brachial pulse is on the crook of your arm, usually on the inside. You want to press lightly and you'll feel that pulse. So the pulse is how you measure your heart rate. So you have your brachial pulse here. You also have your radial pulse, which is right below your thumb. And again, using 2 fingers and pressing gently is how you can check your pulse. And when you measure it for 15 seconds and multiply it by 4, that's going to give you what your heart rate is per minute. And the best place to be with that is between 60 and 80. If it's too low, that can be an issue. If it's running too high, that can be an issue. So the nice thing about what's going to be measured here today with your blood pressure cuff is going to give you the systolic reading, which is the top number, and that measures the pressure of your heart when your heart is contracting. It measures your diastolic blood pressure, which is the bottom number, and that measures the pressure when your heart is relaxing. And this also gives you your heart rate, your pulse. So you'll get your systolic, diastolic, and heart rate when you're checking your blood pressure. So you want to make sure that your cuff is at least an inch above the crook of your arm. You don't want it too low or too high. You want to make sure that you can get at least a couple fingers underneath there. If it's too tight, it might give you a higher reading. If it's too loose, it might give you a higher reading. So how you have that on there is important. So as I said, you're going to sit relaxed. You're going to take a couple of deep breaths before you check your blood pressure. And then keep your hand and your arm as relaxed as you can. You press the start button and do not talk while you're having your blood pressure checked. Okay, so you'll have your reading there that your monitor is showing you, And a lot of these cuffs also have a memory on there. If you press the button, it will show you your memory, and if you forget to write it down, or if you want to bring it into your doctor's office to show him, you'll have multiple readings to show what you've been getting at home. So the best place to be with your blood pressure is below 120/80. That's the optimal blood pressure. The systolic blood pressure of 120 to 129 is considered an elevated blood pressure. High blood pressure for the systolic is 130 to 139, and the diastolic, the bottom number, 80 to 89. That's stage 1. Stage 2 high blood pressure is 140 or higher, and systolic and diastolic 90 or higher. If you have a blood pressure where the top number is 180 or higher, or the bottom number is 120 or higher, that's a hypertensive crisis, and that's where you want to get immediate medical attention, whether it's going to the emergency room or calling your doctor right away, but that's something that needs immediate attention. So if you are working on lowering your blood pressure, if you're doing this and you're not taking any medication for your blood pressure, some things to start with to help bring your blood pressure down is looking at how much sodium that you're taking in. Some people are more sensitive to salt than others, and it's just not how much salt you put on your foods, it's how much sodium is in the foods that you're eating, because it's in a lot of the packaged foods. So reading the label is important. An easy tip when you're reading the label is, and you're looking at sodium, is that 5% is low and 20% is high. So knowing what a serving size is, and then looking at how much sodium is in that per serving. And that can be surprising to a lot of people, especially like with soups and crackers and snack foods, so that's important to do. Another good thing to start looking at is if you're smoking, of course, quit smoking. That can help immediately to lower your blood pressure and lower your heart rate. If you notice that you're getting some high readings and haven't been sleeping well, again, that can raise your blood pressure. So looking at how you could make changes to sleep better. If your work is very stressful or home life is very stressful, that can affect your blood pressure. So working on stress reduction, either through meditation, exercise, walking, just being outside, breathing some fresh air, anything to help reduce your stress, that can help your blood pressure also. So this can be a really nice tool. You can see a cause and effect. If you ate out the night before, you notice that your blood pressure is really high, then you know, okay, I probably took in too much sodium, and to not do that as often as you may be doing. Some other things that can be helpful with your blood pressure is to be able to share these with your doctor, because a lot of times when you go to the doctor's office, you get higher readings than you do at home. So this is really important to be able to show these to your doctors, because if you are thinking about starting on medication, this might be something that can help prevent you from taking medication. But if there is a need to take medication, then this is going to be able to give you some good feedback on if your medication is working well for you. If you're taking your medication every day and your blood pressure is still high, then that could be that you are not taking the right medication for you. So in summary, home blood pressure monitoring is very common, very beneficial. It can help assist your doctor with making a diagnosis, with helping with treatment. So a really good tool for you. So I appreciate you listening today, and I hope this was helpful.